second part of the heart. Let's go. We were talking about the valves opening and closing as the blood goes through the heart. So if you look at the textbook, here's a little animation that shows the blood going through the heart and the valves opening and closing. As the valves open and close, they will make the heart sound, which is heard as lub-dub, lub-dub, lub-dub. So I've got it connected here. Let's see if we can make it work. Good. So that is seen as lub-dub, lub-dub, lub-dub. And when the first sound, the lub, is the strongest sound, and that is the contraction of the ventricles. Sorry about that cough again. The contraction of the ventricles. As you notice, when the ventricles contract, these valves here close, and these are the atrioventricular valves, the tricuspid and the bicuspid. And they close, and it's the closing of, it's the movement of the fluid as they close that makes the heart sound. It's not the heart banging shut or the valves banging shut like you bang a gate, but it's more like when you pull a bathtub and you get that sound when the sound goes down the tub. So that is how the heart sound is. The first heart sound is the closing of the atrioventricular. And then you can only see one valve here, the aortic valve. Or no, that's the pulmonary valve. The second is the closing of the pulmonary and the aortic valve. So lub-dub, lub, lub-dub, 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 lub-dub. Okay? So that is the sounds. Good. Now, when we look at the heart muscle itself, it has coronary arteries on the outside, and I showed that in the other video. Basically, the function of the coronary arteries are to feed blood to the heart muscle itself. You don't have to worry about all the names of them. Just realize that although all this blood goes through the heart, it doesn't feed the heart muscle itself. That's what the coronary arteries are for. Okay, now we also have to add some terminology because we can't just say contract and relax. Systole is a fancy word for contraction, and diastole is for relaxation. Okay? Oh, can't spell. Relaxation. There we go. Okay, now this is done based on some rhythm. Now we'll go to the textbook and look at those terms. The heart is electrically stimulated to make it beat, and it is set by what's called a sinus rhythm, and it's established by the pacemaker cells. And the pacemaker cells are located in what is called the sinoatrial node up here in this sinus, and it is the pacemaker cells. Then the information, the electrical information, comes from the sinoatrial node to the atrioventricular node. Then the electrical stimulation goes down the AV bundles, also called the bundle of His, and then up the bundle branches to the Purkinje fibers, which are on the outside. And that's what causes the heart to contract, is this Purkinje fibers. So the electrical conductivity goes through, and there's a beautiful video that will show you this. So take a second and watch that video. Okay, as you watch the video here, connecting here, you can see that there are some parts. The SA node, also called the sinoatrial node, the atrioventricular node, and then you have the bundles, the bundle branches, and the Purkinje fibers. And that is the way the electrical conductivity travels through the heart. Now, as it travels through the heart, it creates something called an ECG. And you'll often see the ECG, it's the blip blip. Okay, let's look at the cardiac conduction system, which is based on the ECG.
The heart's conduction system controls the generation and propagation of electrical signals, or action potentials, that cause the heart's muscles to contract and the heart to pump blood. This electrical activity can be measured at electrodes placed at specific points on the skin, from which a composite recording is produced in the form of a graph. This recording is known as an electrocardiogram.
Okay, so we've often see this blip blip that goes by, especially if you're watching a TV show when someone's about to die. There are many parts to it. You basically just need to know the P wave, the QRS complex, and the T wave.
Or ECG, sometimes referred to as an EKG. A tracing of the overall electrical activity of the heart.
Okay, so it's the overall electrical activity of the heart. I will let you watch the video on your own to get more detail, but I'm more concerned with the P wave, which is what's called depolarization of the atrial, and realize that depolarization causes contraction, which is called systole if we throw in more words. Then we have the QRS segment, which is the ventricular depolarization. And then we have the T wave, which is ventricular relaxation. Good. Finish the video on your own and then finish the worksheet on your own.